of Representatives, District 54, we have two candidates, and we're going to start with Brandon. You have 2 minutes to tell us about yourself.
Thank you, Woody, and thank you to the Chamber for hosting this event. Thank you to all of you who took time out of your evenings to come here and listen to us tell you why we want this job. Listen, my name is Brandon Phelps. I'm running to be our next state rep of the 54th District. I have lived here, I've worked here my whole adult life. My wife Angie is here with us tonight. My oldest daughter Morgan is here. I don't think my youngest daughter is Allie here. There's Allie. She's in here. But listen, I've been here, worked here my whole adult life. We've raised our girls here. They've gone through the Warrensburg school system. I'm a local business owner in the landscape business, and Angie's a physician here. We love our community. We love our community. We love taking part in our community. We love everything that this is about. We love the great state of Missouri. We're proud, patriotic Americans. That is exactly why I'm running. I'm running so I can stand up for our values, our conservative values here in the 54th District and in Johnson County. I'm running so that I can look after this community that I love so much. So I'm asking you to elect me to be our next state rep. I will go to Jeff City and I will represent us with professionalism, with strength, with diplomacy, with tenacity, and most importantly, common sense. So I'm asking you to vote for Brandon Phelps on August 6th. Thank you very much.
All right, Matt, 2 minutes.
Good evening, I'm Matt Sargent, and I would like to thank my wife, Mindy, for being here. We're 9 days away from our 14th anniversary. And of course, my daughter Emma has came in and, one of the reasons I run, and I'm running, because of her and our granddaughter, so for their future. So anyway, sorry. I'm pro-life, pro-gun, pro-education, pro-small business, and pro-Trump, and pro-Johnson County, Missouri. Did I mention pro-Trump? I want to make sure we get that out. As a fiscal conservative, I will advocate for tax cuts and reduce government spending. And as a fiscal conservative, I went into this campaign knowing that I only wanted to spend $15,000. I know some people may say that seems like a lot, some people may say that seems like a little amount. I really didn't know. I went into it saying I'm going to spend $15,000. I'm not going to, we campaigned one time. We went up to our fundraiser one time. And so we have spent a little less as of July 1st than $14,000. And my idea was that, of course, we would spend every dime in Johnson County, and we have not spent anything outside of Johnson County because you should buy local. Unlike my opponent, who spent over $11,000 outside of Johnson County. So I've been vetted. Some people say vetting is a good thing. Some people say vetting is a bad thing. I vetted so you, the voters, will know that I will do what I say in Jeff City when I get there. I will do what I say. I shouldn't have to say that, I agree, because that's who I am. I am the person who would not do those things anyways. But I am not a campaign Republican, I am a conservative fighter. So I humbly ask for your vote August 6th for Matt Sargent, and let's get it done.
First question, guys, and who started? Brenda started, so you get the first question. The question is number 15. Question number 15. Turn my page.
We don't have 15.
We don't have 15. There's only 14.
Hey, let's get one out there that we don't know.
Let's see what this one says. Number 8, all right. And it's a one-liner. What will you personally do to foster civility and statesmanship in the House?
Personally, we all know hostility will not solve anything, and fighting and amongst ourselves or amongst Democrats is not going to get anything done. But I do have a statement. A politician worries about the next election. A statesman worries about the next generation. From James Freeman Clark. And I would like to be your statesman, not your politician.
Same question, what will you personally do to foster civility and statesmanship in the House?
Well, I think first and foremost, you are civil. I will be civil. And I will be a statesman. So the short answer is you're civil and you're a statesman. The long answer is this. Listen, when we're asking people to go and represent us in Jefferson City, we need to not just hope that they're going to be the person that they say they are. We need to know it. I'm someone who has lived here a long time, as I've already said. Those of you who know me know that I am a civil person. You know that I'm professional. You know that I can do this job with diplomacy. You know that I can do this job as a leader. And that is actually statesmanship. Looking at a person's past can tell you a whole bunch about who they are and how they're going to be when they move forward. I would tell you that as we go through the campaign process, campaigns so often to the voters seem like folks like us that are running for office coming to you and giving you our sales pitch as to why we want the job. But the campaign is also a sneak peek or a preview of who you're going to get in elected office. And I think it's really important that we watch how people campaign. I think it's important that we watch the things they do and they say as they campaign. And we think about that when we go to the ballot box. I'm going to be somebody that you can count on to be civil. I'm going to be someone that you know over the last 30 years of knowing me that I will be a statesman. That's why I want to be your next state rep. Thank you.
All right, keep the mic because you get the first one here. And it's number 11. There is an 11, I think. As of 2022, abortion in Missouri is illegal, with abortions only being legal in cases of medical emergency. This makes access to abortion services difficult. Do you support Missouri's current laws on abortion?
Yes, I am a pro-life candidate. I've been pro-life for as long as I can remember. I'm very proud to say that I've been endorsed by Missouri Right to Life. And listen, the current Missouri state law is that abortion is illegal in the state of Missouri. I absolutely support that. Abortion's going to be back on the ballot, unfortunately, in November. Unfortunately, with IEP reform not having passed this past session, that puts us in a little bit of a situation that we were hoping to not be in. But we will see how the voters of Missouri vote come November. But yes, I proudly support that state's law and the individuals that passed it a couple years ago. That's a strong law, and I support it.
All right, Matt, I'll read it for you. As of 2022, abortion in Missouri is illegal, with abortions only being legal in cases of medical emergency. Now, this makes access to abortion services difficult, so do you support Missouri's current laws on abortion?
Yes, I do. I also have been endorsed by Missouri Right to Life, and I know that we have great resources in this area, one of them being New Beginnings. Our friends Jason and Melanie Sharp and Justin and Melanie Harris started New Beginnings. I don't know if you have the option or a chance to go by. They are doing a fundraiser right now, and they are needing money. It would be great if everybody can stop by there. But they educate, they teach for not just the mother, but the father also. And so there's a lot of options out there that I would love for people to look into besides abortion. It's something near and dear to me, which most of you know, that we were lucky to have our grandchild, and we're definitely happy, and so abortion is a horrible thing.
All right, you keep the mic. And the next one is number 9. Question 9 is, what can state legislators do to improve access to mental health care for the most vulnerable Missourians, those who are low income and or have no health insurance?
Once again, community resources go a long ways towards this. And that might be that we have to invest in more places for them to go to in your area or closer to the area where there might be spots where there's nothing around. But we need to expand telehealth and telemedicine. Virtual, I know it sounds bad, but virtual medicine has become a huge part of our health insurance and our health policy now. And I think that would be a huge part, a huge step. And we have to promote health education. I'm sure a lot of you have been to UCM and have got to see that they have their employees go and they do blood draws, they do health questions, they do weight, they do everything, but it's all towards the health education for the people. And so that helps with the cost, and it is, they're finding more and more and more that health, education, and health wellness goes a lot towards mental state.
Okay, I'll read it for you, Brendan. What can state legislators do to improve access to mental health care for the most vulnerable Missourians, those who are low income and/or have no health insurance?
Well, I think it is, telehealth has been something that's been discussed a lot tonight. Telehealth is certainly something that we're going to have to be moving towards. It does make things more affordable. That's an efficient and effective way to do things. There's been a lot of talk about public-private sponsorships, and that's probably something that we may have to do moving forward. The other thing is we're going to have to find a way to make it so that individuals looking for mental health, if they're looking for mental health care, that they're not having to travel an hour or an hour and a half to go to Columbia or Kansas City or St. Louis. So one of the ways we can do this is to address the areas that are underserved throughout the state, to designate underserved areas and incentivize people coming out of medical school to work in those areas. So several years ago, I don't know if they still do this now, but if you were a general physician or a family practice physician, when you came out of medical school, the state of Missouri had designated areas that were underserved, and they would incentivize you to go to those. And in some cases, they would reimburse you for a portion of your medical school tuition or the expenses if you would agree to work so much time in this underserved area. And doing something like that would maybe bring some of these providers to some of our underserved areas so we could cut the time and the travel that it takes for people to get that mental health help. And like we've all said, certainly expanding telehealth is also another option.
All right, you keep it. Number two, what is your position on the termination or reduction of Missouri state income taxes, personal